Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Now we will be studying about the disorders of spleen and thymus. Okay, so from this you will be getting a short note. Prepare this topic in such manner. Okay, so spleen basically filters your blood and removes the old RBCs, and thymus, what it does, it is the site for T cell maturation. Remember this is the basic that you need to know. What are the disorders of the spleen? First thing first, you have the splenomegaly, that is the enlargement of the spleen. Okay, so definition is there is enlargement of the spleen beyond its normal size. Okay, so it can be either mild, it can be either moderate or massive. Now, the mild one weight is up to 500 grams, and the example is it is seen in acute infection. Moderate one is 500 to 1000 grams, seen in the chronic infection, and the massive one is beyond 1000 grams. It is seen in leukemia and malaria infection. Okay, what are the causes? See, causes of splenomegaly is itself a separate question. Okay, short note. This one itself is a short note. What are the causes of splenomegaly? Infection. It can be malaria, kala-azar, typhoid, and infectious mononucleosis. Congestive is portal hypertension, splenic vein thrombosis. Hemolytic anemia, examples are thalassemia and hereditary spherocytosis. Next thing, myeloproliferative, there can be chronic myeloid leukemia and hairy cell leukemia and lymphoma. Storage disease, Gaucher's and Niemann-Pick disease. Inflammatory is rheumatoid arthritis and SLE. Miscellaneous is amyloidosis and sarcoidosis. What are the pathophysiology? For the pathophysiology, remember three things. It can be congestive, that is blood pooling due to the venous obstruction that will cause the red pulp expansion. For the infectious, remember there can be hyperplasia of lymphoid tissue. For the myeloproliferative, there can be infiltrative by the neoplastic cells. What are the clinical features? The clinical features, there can be left upper quadrant fullness of pain, early satiety, hypersplenism, and there will be a risk of rupture. Coming on to the next thing, that is hypersplenism. Now, this is characterized by overactive spleen. The spleen becomes overactive, hyperactive, just like your mother. The spleen becomes overactive. The causes are resulting in splenomegaly, cytopenia, and compensatory hyperplasia and involvement of and improvement after the splenectomy. What is the mechanism? There is excessive sequestration or destruction of the blood cells. What are the causes? Portal hypertension, chronic malaria, lymphomas, and storage diseases. What is the treatment? You have to treat the underlying cause and you have to do the splenectomy in severe cases. Splenic rupture. What are the causes? It can be due to the blunt trauma. What are the consequences? There can be acute intra-abdominal hemorrhage. Okay. Then surgical emergency, you have to do the splenectomy. Coming on to the next thing, that is infarction of spleen. Now, infarction of spleen is due to the embolism, thrombosis, or torsion. It can be wedge-shaped and pale infarct. They may cause pain and fever. Coming on to the next, that is atrophy of spleen. Okay. For the atrophy of spleen, you have the causes are aging. Then there can be sickle cell disease and wasting disease like cachexia. Accessory spleen, congenital small nodules of splenic tissues can be seen. Then you have the splenic cyst and tumors. Okay. So in the splenic cyst, what are the things you have? You have the congenital cyst, secondary cyst, and neoplastic cyst. In the congenital cyst, they are lined by the epithelium. In the secondary cyst, you have post-traumatic and parasitic. In the neoplastic one, you have the lymphoma and hemangioma. Coming on to the next thing. Next thing is the functional asplenia. Okay. They occur mainly after the splenectomy or in sickle cell disease. There is increased susceptibility to the encapsulated bacteria. That is prevented by the vaccination. That is why it is very much advisable for the person who have undergone the spleen removal to have the vaccination. Okay, the pneumococcal or the meningococcal. Now you have the disorders of the thymus. For that, first thing you have is the congenital, that is your Dijk's syndrome. So the cause is 22q11.2 deletion. I have also told you in the genetic section, I guess, that there is failure of third and fourth pharyngeal pouch. What is the defect? There is defect in thymic and parathyroid hyperplasia. What are the features? There is decreased in T cell immunity, recurrent viral and fungal infection, there is decrease in the parathyroid, and there can be cardiac anomalies. What is the treatment? Thymic or bone marrow transplantation. Then you have is the acquired thymic atrophy. It is seen in aging, severe stress, and corticosteroid therapy. Then you have is the thymic hyperplasia. Now this thymic hyperplasia can be of two types. Either it can be true or either it can be the lymphoid hyperplasia. Now in the true hyperplasia, what happens is there is increase in the thymic lymphoid tissues and it may be reactive. Then you have is the lymphoid hyperplasia. It is characterized by the formation of lymphoid follicles with germinal centers in the thymus, commonly associated with the autoimmune disease like Myasthenia gravis, SLE, and rheumatoid arthritis. Now, the next thing that you have is the thymic neoplasm. They are the tumors derived from the thymic epithelial cell. They are usually in the anterior mediastinum. What are the classification? For the classification, you have two types, benign thyoma and the malignant thyoma. Okay. Now, the benign one are encapsulated and the malignant one are invasive or cytologically malignant. They are associated with Myasthenia gravis, pure red cell, and hypogammaglobulinemia. What are the clinical features? The clinical features can be anterior mediastinal mass, symptoms of compressions, and myasthenic symptoms. How will you diagnose it? By doing a chest X-ray or CT scan. What is the treatment? You have to give the surgical excision to the patient and thymectomy. Coming on to the next thing, that is the thymic cyst. Now in the thymic cyst, it can be congenital or either it can be acquired. Next is thymic lymphoma. In the thymic lymphoma, they are mainly seen in the young adults, rapidly enlarging anterior mediastinal mass. It is often part of T cell lymphoblastic leukemia. This is the summary table that I have given for you all. Okay, here you have the organs, disorders, and the key features. Spleen and thymus, splenomegaly, hypersplenism, rupture, infarct, atrophy, cyst, and tumors. Okay. Then you have hyperplasia, thymoma, thymic carcinoma, and lymphoma. For splenomegaly, the key features are infections and congestion. For hypersplenism, cytopenia, rupture is trauma, infarct is emboli formation, atrophy is sickle cell and aging, cyst is hydrated. Then you have hyperplasia, there is decrease in the T cell count. Then you have hyperplasia, it is associated with Myasthenia gravis, thymoma, anterior mediastinal tumor, and thymic carcinoma, malignant and invasive. For the lymphoma, it is rapidly growing mediastinal mass. So this was all about the spleen and thymic disorders. If you have any sort of doubt, please don't hesitate. Please feel free to ask me. Please feel free to DM me. Thank you so much.